Hello, I'm Richard Wells, and this is An Initiation to the Blood. I have no relevant disclosures of conflict of interest. Our learning objectives are these. We should be able to describe the morphology of red cells, white cells, and platelets, and describe the types of white blood cells. Our module objectives are here. By the end of this module, you should, 1, know the constituents of the blood, 2, understand where blood cells come from, 3, recognize the cells in the normal peripheral blood film, and 4, be aware of common morphological abnormalities of blood cells. The blood, the red stuff, life, but what's it made of? What does it do, and where does it come from? These questions will be answered in just the next few minutes. The blood is a complicated thing. It's full of liquid and cells. The liquid is called the plasma. It carries nutrients, electrolytes, and proteins, including the coagulation proteins, which are one important reason that bleeding always stops. But that's not all. Blood also contains cells, many diverse, various cells. Let me tell you about them. First of all, there are red blood cells. Red blood cells are red. They carry oxygen. White blood cells may or may not be white, but they're there to fight infection. And platelets plug holes. They're the other reason that bleeding always stops. Depending on the type of cell, they may last for a few hours, a few days, or a few weeks. But then they wear out, and when blood cells wear out, they're removed from the circulation, mainly in the spleen and the liver. But what this means is that in order to maintain the right number of cells circulating in the blood, in order to maintain perfect health, the body needs to make new blood cells. Where does this happen, and how does it happen? Well, it happens in the bone marrow. The bone marrow, as you can see in this picture, is inside the bones. And it's a complex medium in which the beautiful process of hematopoiesis occurs. Hematopoiesis is the generation of mature blood cells of these three categories through the differentiation of the hematopoietic stem cell. You can think of hematopoiesis as being like a factory. 3 assembly lines working round the clock, producing exactly the right numbers of red cells and white cells and platelets to replace those that have worn out, and therefore maintaining the levels at just the right spot. Now, let's have a look at blood cells. And this is the introduction to the blood film. The blood film is, perhaps disappointingly, not an obscure Cronenberg movie. The blood film is made by spreading a monolayer of peripheral blood onto a glass slide, allowing it to dry, and then staining it with certain specific dyes. And this allows us to visualize the beautiful normal cells of the blood. This is a microscopic view at low magnification of a normal peripheral blood film. And what you can see is mostly red blood cells. They are the red ones. And you can see that they have a central pale area that occupies about 1/3 of the width of the cell. This is because of the beautiful biconcave shape of red cells. The next most numerous cell in this peripheral blood film is the platelet, and these are the tiny little dots that you can see sprinkled among the red blood cells. Finally, you can see 3 white blood cells. These are neutrophils. Now, you will probably say, but Dr. Wells, those cells are not white. And in fact, you're right. So why do we call these cells, which are manifestly pink and purple, white blood cells? It comes from the observation that if you take peripheral blood and anticoagulate it and then spin it in a centrifuge, you'll wind up with a fluid that's separated into 3 layers. The top layer is this lovely straw-colored plasma. That's the liquid part of blood. The bottom layer is red. The cells in this layer are the red blood cells. And in between, there's a smaller white-ish layer called the buffy coat. The cells from the white layer are the white blood cells and also the platelets. So the white blood cells are named not after the color they appear on the blood film, but after the color of the layer they wind up in centrifuged blood. I'm glad we've been able to clear that up. So let's go back to the blood film. Now, at higher magnification, we can see that the red blood cells are present, and they're pretty uniform cells. One red cell looks pretty much like the next red cell. The white blood cells are quite different, though, and you can see two white blood cells here. One is a neutrophil. That's the one on the right, and you can see it's got a very funny, oddly shaped nucleus with three big lobes. On the left is a normal peripheral blood lymphocyte. It looks quite different. It's got less cytoplasm, a very round, regular nucleus. As I said, red blood cells tend to be very regular and uniform in appearance. They're round, they have the round bit of central pallor, and one is much like the other. Neutrophils are quite different. The appearance of neutrophils is very heterogeneous, which is to say, neutrophils are like snowflakes. No two are exactly identical. In this film, you can also see some platelets. Platelets are tiny, small, featureless bits of broken off cytoplasm. Now, although normally in health, red blood cells all look pretty regular, in certain disease states, they can change. And I want to show you a few of these. First of all, sickle cell disease. Sickle cell disease is a very famous hemoglobinopathy. It's caused by an inherited defect in beta globin, which results in a single amino acid change. This causes the formation of a beta globin that polymerizes under conditions of oxidative stress. And when this polymerization happens, it changes the shape of the red blood cell so that it becomes pointy at both ends. And you can see these cells in the film are pointy at both ends. These are called sickle cells, and they're the pathological hallmark of sickle cell disease. You can also get red blood cell changes in kidney failure. This is a blood film from a patient with uremia, meaning kidney failure. And you can see that the red cells have these regular little bumps on their surface. These are called Burr cells, characteristic of this condition. We also see changes in liver disease. These cells are a bit different. They have irregular, spiky projections on their surface. This type of cell is called an acanthocyte. And these changes are caused by alterations in the lipid composition of the red blood cell membrane. Now, this is something different. These red blood cells have something in them. And what you see are the ring forms of the malaria parasite. This is Plasmodium falciparum. There are certain different diseases that are caused by intracellular red cell parasites that can show up on the peripheral blood film very beautifully, like this. And here's another type of red blood cell abnormality. You can see that the cells that are pointed out by the arrows here are a bit darker than the ordinary blood cells near them, and they lack the central pallor. They're also a bit small. These are called spherocytes, and we see spherocytes commonly in autoimmune hemolytic anemia, and also as a congenital red cell defect. They look like spherocytes because indeed they are spherical. Some of the membrane has been lost, and the cell has lost its biconcave shape and become a sphere. So I've shown you some sick red cells. Let's have a look at some sick neutrophils. The commonest neutrophil abnormality that we see down the microscope looking at the peripheral blood film is this, toxic granulation. Toxic granulation occurs typically in response to bacterial infection. And you can see that these neutrophils look a bit odd. They have very pronounced dark granules. That's called toxic granulation. And also, some of them have quite pronounced vacuoles in the cytoplasm. These are activated angry neutrophils ready to phagocytose and kill bacteria. Here's another neutrophil abnormality. This is a hypersegmented neutrophil. I've told you already that neutrophil nuclei are normally segmented, but typically neutrophils have 3 or 4 segments in the nucleus. You can see that this neutrophil in the center of the film has about 6 or possibly 7 nuclear segments. That's too many. Also pointed out in this film are 2 red blood cells. Red blood cells are larger than average and also have a pronounced oval shape. They're oval macrocytes. presence of oval macrocytes and hypersegmented neutrophils screams out a diagnosis of megaloblastic anemia caused by, for example, vitamin B12 deficiency or folate deficiency. Here's an abnormality on the other end of the scale. The neutrophil pointed out by the big yellow arrow has a nucleus with only a tiny little indentation, really just a single lobe, and also there are hardly any granules in the cytoplasm. This is a hypogranular, hypolobated neutrophil. And this is the type of neutrophil that we see commonly with malignancies of the bone marrow, like acute leukemia and particularly myelodysplastic syndrome. There's a second abnormality here, and that's the giant platelet up above. You can see there's a platelet pointed out by the arrow that's as big as a red blood cell. This is wildly too big, and it also indicates a bone marrow disease. Let's go on to lymphocytes. The lymphocytes that we see in the peripheral blood look like this. This lymphocyte may be a T cell, may be a B cell. We can't tell by looking at it down the microscope. There are ways of figuring out and distinguishing T cells from B cells, and you should know about them. Look it up. I had to. I'm not going to tell you the answer. So this is a normal-looking peripheral blood lymphocyte. It's round. It's got blue cytoplasm. There may be a few very fine granules in the cytoplasm, and it's got a regular roundish nucleus. One interesting and useful fact about peripheral blood lymphocytes is that the peripheral blood lymphocyte nucleus is about the size of a normal red blood cell. So we can actually use this to judge whether the red cells are of normal size or not. Here, the nucleus looks about the same size as the red cells surrounding the lymphocyte. But have a look here. Here's a peripheral blood lymphocyte, and you can see that its nucleus is much, much bigger than the red cells surrounding it. This indicates that the red cells are too small, red cell microcytosis. You'd have to think in a case like this that the patient could have, for example, iron deficiency or thalassemia, or one of the other conditions that causes microcytosis. Other end of the scale, here's a peripheral blood film with great big red blood cells that are clearly much bigger even than the whole lymphocyte. This is red blood cell macrocytosis. Again, we think of a differential diagnosis including B12 and folate deficiency, myelodysplastic syndrome, and liver disease. Now, here are some rather exotic lymphocytes. These are called atypical lymphocytes, and they look quite different from the normal resting lymphocytes I've just been showing you. They've got this wonderful Eve Klein blue edge, and the edge of the lymphocytes is kissing the red blood cells. These are atypical lymphocytes, and they're seen particularly in certain viral infections, classically with the Epstein-Barr virus infection that causes infectious mononucleosis. Now, the third type of ordinary blood cell is the monocyte. Monocytes look a bit different to both lymphocytes and neutrophils. They have an irregular, often kidney-shaped, or if you're vegetarian, kidney bean-shaped nucleus. And there are quite coarse granules in the cytoplasm and often also vacuoles. Now, there are two more forms of normal blood cells that are actually rather seldom seen. And so I'll call those collectively exotic white blood cells. First, eosinophils. Eos is Greek for the dawn. Imagine the golden rays of the sun filtering through the cloud over the Aegean. So they've got this beautiful orangey, peachish color and quite coarse granulation in the cytoplasm. These cells are usually difficult to find, but they may be seen in great numbers, for example, in the case of allergic reactions or drug reactions, and combined with certain malignancies like Hodgkin disease. This is a basophil. A basophil is a white blood cell that's chock-a-block packed with these dense, dark blue granules. It looks, to my eye, to be quite irritated. Basophils are rare cells. If you see numerous basophils, something's wrong. And the classic association is between increased basophil count and the disease chronic myeloid leukemia. Now, if you're ready, I'd like to give you a couple of quizzes. So here's our first quiz question. In which organs are senescent blood cells removed from the blood? Have a think. The spleen and the liver. Next question. You see a 90-year-old man who presents with dyspnea. After examining him, you are uncertain if the diagnosis is congestive heart failure or pneumonia. Which blood film abnormality might help you distinguish between these possible diagnoses? Pause the video and have a think. If you found toxic granulation of neutrophils, that would suggest the presence of infection and may make you favor the diagnosis of pneumonia. In this case, you might also see something called a left shift. And if you don't know what that is, watch the next video. Where are new blood cells formed? Well, the bone marrow. But, in fact, during prenatal development, new blood cells are also formed in the yolk sac and the liver. And in some disease states, for example, idiopathic myelofibrosis, there may be blood cell formation in the spleen or other organs. Next question. A 75-year-old woman who subsists mainly on tea and toast is found to have macrocytic anemia. Explain how examination of her peripheral blood film may provide important clues to her diagnosis. So I think there are three possible diagnoses here: megaloblastic anemia, myelodysplastic syndrome, and hemolytic anemia. With megaloblastic anemia, we'd see hypersegmented neutrophils. With myelodysplastic syndrome, we'd see kind of the opposite, hypolobated and or hypogranular neutrophils, and we might see other abnormalities like giant platelets. If she has hemolytic anemia, then we'd expect to see polychromasia. That's the presence of an excess of young blood cells, young red blood cells, and also spherocytes. So we've come to the end of our video. By now, you should be able to know the constituents of the blood, understand where blood cells come from, and recognize the cells in the normal peripheral blood film. You should also be aware of common morphological abnormalities of blood cells. And with this, I'll sign off and wish you a bloody good day.